All right, I got Dr. Richard Downs and Dr. Shane Smith on the show today. Dr. Richard Downs, you are a specialist in sleep, dentistry, oral, facial, all that good stuff. And Dr. Shane, you're an upper cervical doc, specializing in the spine and specific the cervical portion of the spine.
Yeah, central nervous system. Yeah.
Yep. Awesome. Well, super excited to have you. We're here live in Nashville at the Black Diamond Club conference, where only the best hang out. And I was fascinated by what you got over there, Rick, which is we were talking about sleep, and we were talking about the importance of the airway and how 40% of children with ADHD, and I think your estimate is it's even higher, Joel, it's probably 70% of people with ADHD have probably a breathing problem.
Yeah.
And I was telling you about all my breathing issues and the jaw, and you're like, dude, let me tell you about what we're doing and some of the results we're seeing and how permanent it is. I said, we got to get on a podcast and talk about this. And Shane, I know you're working closely with Dr. Downs. So really excited to talk to you guys about everything and what you're doing to disrupt the industry and the world, which I think is a major deficit right now in learning, breathing, my own issues, performance, the parasympathetic, the nervous system.
Yes.
So, man, talk to me, guys, how you guys got started and why you're so passionate about it.
Well, first of all, thanks for having us. It's pretty interesting how all this just kind of happened.
Yeah.
None of this was planned, so I'm really glad it worked out and happy to share the story and the message. Dr. Rick and I met at a similar BDC event. It's had to have been 2.5 years ago by now, I'd say. And we were just kind of discussing, I was talking about the central nervous system, how important it is. My whole job as an upper cervical doctor is to help restore autonomic function, to get people ideally living in more of a parasympathetic response, rest and digest, calm. That's when we heal, that's when we sleep. And Rick was in agreement, and then he's like, however, what I'm seeing from my career of 40 years, a lot of people are literally suffocating every single night, and they either they don't know or they know, but they don't want the only therapy, which tends to be a CPAP.
Yeah.
And
I've had that, and it was terrible.
They're not great.
Absolutely terrible.
Yeah, and so, he was telling me the rate of compliance with these things and how little success they're having. And then the number of other diseases and disorders. And in my world, it's when you're suffocating, you can't help but go into a fight or flight response. That's that sympathetic nervous system kicking back in, essentially stopping forward progress from what I'm trying to do. So I was like, well, we should maybe work together and figure out how we can make our two professions come together and serve a remarkable amount of people who are suffering with this. And they're dying.
Yeah.
Like there's no help for them. And so that's kind of was the foundation. There's a huge need, and that's what we're here to do.
It's interesting too, because I'm sure for you, right, and I'm guaranteeing you adjust people, you do the upper cervical technique to balance people's nervous system. Mm-hmm. They go back then in their lives, they're feeling great, but then their sleep is compromised because they're breathing, their mouth breathing. Mm-hmm. And then all the work that you've done, I'm sure, just comes untangled, right? So if you can actually do this and then reinforce it with the upper cervical adjustment, I bet you get stickier results, right?
We already have. Some of the patients I have, we monitor everything. We're super objective data nerds. Every clinical decision we make is based off objective data. And so having now patients be able to be monitored to kind of watch the outcome, we're already seeing patients hold their adjustments longer. So in my world, I don't like to adjust patients very often. The goal is I want you to stay adjusted, right? Like you shouldn't need to be living in my office. Love my patients, but I don't want them living there.
Right.
And so we want to adjust them minimally and with the expectation that the body is self-sufficient.
Yeah.
And then if we can then create an environment that they're going to do every night anyway, which is attempt to sleep, and amplify that opportunity to rest and recover and regenerate, then we're going to win.
Yeah.
The health game.
So crucial. I love that. Dr. Downs, so talk to me. What was your discovery into this, and how did you get started into the sleep dentistry world?
Well, I'm retired from general dentistry. I've created a number of businesses. I started learning about airway dentistry almost 17 years ago. And when I went into it, I had no idea that I had obstructive sleep apnea. I knew that I snored. And I snored so loudly that it was disruptive to my wife's sleep. And so I got tested.
My wife won't let me sleep in the same room.
No, I'm in the same boat.
It's disruptive.
I'm in the same boat. You can hear the snore through the doors, closed doors. And it is that bad. And everybody kind of laughs about it, but it's actually a serious problem. The estimate is that 80% of people who snore have obstructive sleep apnea. And obstructive sleep apnea, they don't realize, is one of the most devastating things we can have. It disrupts multiple things. You get strokes, you get diabetes, you get cancer, you get heart disease. It all comes, and it's being treated mostly with drugs and surgery, which is not necessary because dentists have learned how to actually open up the airways. And we can actually open up the airways permanently with mouth expansion. And not only is the upper arch expanded, but the nose is also expanded because the upper arch is also the floor of the sinus or the floor of the nose. So we found that out. And by the way, what Dr. Smith was saying right now, these people not holding the chiropractic adjustments. What happened was I got into training dentists in sleep apnea. And almost all dentists learned in the early days to just do a lower mandible, lower jaw removal forward. And they use different types of oral appliances, which when you bring the lower jaw forward, it brings the tongue out. It's kind of like CPR.
Yeah.
When you do a CPR, you bring the jaw forward and then you breathe for the patient. Well, that's exactly what dentists are doing. But now this has actually become far down on the list now for what dentists can do. We've actually been able to cure some patients. 25% of patients in some forms of this problem are permanently cured, and that's unheard of, okay? But what Shane was talking about, Dr. Smith, was the chiropractic adjustments are not holding, and people are clenching in the middle of the night and grinding their teeth to strengthen these muscles to open the airway. Now you have people out there giving Botox injections to people with grinding and clenching, and that's a bad thing because if they haven't tested them for sleep apnea, they're making that problem worse, okay? That is really a bad idea. So I decided about 3 years ago that chiropractic was a profession that was untapped in this area for sleep apnea, and that they could actually transform our whole nation's healthcare system if we got them involved. And Shane has been the leader, and he's the champion among chiropractors in this country and around the world, in my opinion, for bringing chiropractors into awareness of what they can do to find these 75 million patients who are walking around with sleep apnea and they don't even know it.
Yeah.
It's devastating. And so I'm so proud of him because he's become the champion of the chiropractic profession in leading them towards this type of healthcare.
Yeah. Amazing stuff. And to your point, I was just reading James Nestor's book, Breathe.
Yes.
And he was talking about, and it's interesting, we see
Wonderful
this a lot.
book.
Yeah, we see that, disease is typically caused from lack of circulation and inflammation, or so lack of blood flow, right? And that's why things like red light work really well. And he said the top cancers, like the top 10, right? 8 out of the top 10 cancers, they're all created from lack of blood flow. And if you're not breathing correctly, we have organs, all of our organs, like you mentioned, if they're not getting proper blood flow, because there's kinks in that thing, because we're not getting airflow, energy, circulation, the synergy, the nervous system, there's kinks in it, you're gonna have problems. And so when you open up the airways, it's a massive deal. What we're talking about is not just improved sleep and improved nervous system, it's improved overall health. We're talking about cancers and a lot of other things. So I think it's so important. That book reminded me how important this is, and that I cannot sleep on it. Literally, I've got to really take charge of this because it's.
Well, I recommend that book and another one called Why We Sleep by Dr. Walker.
Fantastic.
And a wonderful book. And then Jaws, and my book is coming out in November. But those books should be read by every American. Because our faces in the modern society, like mine, is too narrow, and I have what is called a dulcet, long face, receded chin, and this is becoming epidemic in our country.
Yep.
And Shane has a much more normal profile, but he still needs a little broadening of his arches, and most people need that. So it's a big problem, and dentists can do that.
Right, and right now what we see the typical dentist do is actually narrow the face by putting braces on people and constricting the airways.
That's right.
Bringing the nose in tighter, and you see the narrow faces.
It's devastating what's going on in some places. That's changing slowly.
Yeah. talk to us. So like, how do we, if we were coming in, first of all, I don't even know, I know we got mouthpieces here, you got a machine, but so talk to us, like walk us through, like what would it look like for someone like me, 42 years old, coming in? I also have kids, and I told you I'm very curious to possibly have my kids do this, either kids or adults. Walk us through the process of what it typically looks like and how long do people expect to be holding these mouthpieces? You know, for me, I had a Dr. Dwight Jennings, and I had to go once a month and get my mouthpiece adjusted and adjusted. And he told me, even when it gets all fixed, I'm going to have to wear a retainer at night, which I was fine with, man. I mean, if that's what it took to get but you told me, you don't even have to, once we do this, it's going to be permanent, most likely.
Well, no, I didn't say that. 25% of people on a certain type of treatment can get cured, actually cured. Or let's put it this way. Statistically, as we measure sleep apnea, those numbers can go into normal range without any further treatment.
Wow.
But yeah, I'd like Shane to kind of give you his idea what he goes through in a new patient treatment and diagnostics. So go ahead and talk to him, Shane.
You bet. So the first thing we do is we make the patient aware. So we just have a simple screening form, like, hey, thanks for coming in today, Mary. While you're waiting, would you mind filling this simple form out? And it's a standardized form. So we get the questionnaire. We also take a history, obviously. We want to hear what they have to say. What's their life like? And then based on that information, it looks like we need to do a sleep study. So I don't think we have that particular device. It's a little bit bigger than this, but we use an in-home sleep study device where the patient literally goes home with a big ring on their finger. They hit play when they go to bed, and they hit stop when they wake up, and instantly we have that data. And we can make diagnostics based off that information. It's pretty remarkable, way more convenient than going to, a hospital with all that stuff on your face and having some weird person watch you all night.
Yeah.
And so that was one of the things. It's like a lot of people, they might even have an idea that they know something's wrong, but they're not willing to go through that testing.
Yep.
And so they just suffer.
Yeah.
And so does the spouse, who's either you or them are sleeping on the couch. So we get that objective data. And then based on what we find, that then can dictate what it is we're attempting to do with them. If it's super mild and something, on the easier side of things, we can just focus on increasing nasal breathing and nasal passageway, opening that airway up, very non-invasive techniques. We can use something like a bongo here, for example, which is what they call an EPAP, expiratory positive airway pressure. It just helps train the patient to breathe in through their nose. They get their nasal cavities dilated when they wear them, so they get a tremendous amount of airflow in.
Wow.
And then when they exhale, the flaps shut down, and it becomes harder to push the air out. Therefore, you're increasing the pressure in the throat and in the sinus cavity, dilating it. You're also strengthening your diaphragm so you can become a better nasal breather.
Okay, that's really cool. The bongo.
It's pretty sweet.
Okay, I've never heard of this. And so, I mean, I'm even thinking, I know I have issues, but let's say I didn't. I mean, if I were an athlete or a sprinter, I would want to just do this for athletic purposes.
For performance, I mean, the concept of pursed breathing, it's the same idea, but when you do it through the nose, you stimulate a lot of other hormonal responses from the brain. You're doing a lot of good for yourself when you do this.
Can people purchase the bongo, or is this a
that's a prescriptive device?
Okay.
Yeah, so that's why we always start with the sleep study, and we've got some great doctors that we work with that actually write the scripts. Because depending on what state you're in, certain dentists and chiropractors can do certain things.
Yeah.
So we just have all 50 states covered with the doctors that we have.
Sweet.
They write the script for us. And essentially, I mean, they can pretty much prescribe everything for us. So once we get that, now we're free to do as we choose. And we can expedite the process and see what's going to be the best for the patient. If we have to go something a little more extreme, this is called an INAP. That stands for negative airway pressure. So this is for someone who is more of a severe category. This little device creates a suction, essentially. So they wear this mouthpiece at night, similar. It makes a seal. This right here, there's a suction, and it basically grabs the tongue and lifts it up off the back of the throat and just holds it open. So rather than a CPAP, what it's doing, constant positive airway pressure.
How comfortable is that?
People really like it.
Much more comfortable than a CPAP.
It is. Okay,
this has, I think, a 78% success rate, whereas a CPAP is like 13. And it's quiet. You heard that was on, so there's no sound.
I didn't even know it was on. Okay.
Yeah, there's no sound.
Wow.
And there's no moldy air being pushed into your lungs like with a CPAP.
Yeah.
It's basically an air compressor strapped to your face, and so we are trying to eliminate that if at all possible. So this is a device. Then we have, I don't have the actual mouthpiece, but this little machine here. There's the patient would rent this. It's a tonal device for the tongue. They wear it like physical therapy for their tongue, basically. And it stimulates the tongue and throat muscles to become stronger and firmer. So again, when the patient lays down at night, the tongue stays elevated, and we just keep the airway open.
Now, this is really interesting too, Shane, because, I know that for vestibular patients that are working on their balance, there's a lot of research showing that actually stimulating the tongue, even through like electric shocks, very small, mild, but I would imagine it's the same thing, and you can improve balance. And we know the tongue increases vagal tone as well as the nervous system and balance. So I'm imagining there's actually a lot of also downstream good effects by doing this with the tongue.
Yeah, it's a tremendous sensory-driven organ, and so the more you can stimulate those afferents, the amount of data going up into the brain through various organs, the more kind of brain power you get back, and so that's why the company is called Sleep Balance Academy. So because we're seeing changes in balance, that's a separate division, but there's a lot of neat things that you can do that are not like I said, not a CPAP, because that seems to be the only solution that these guys are being offered, and it's really small thinking, unfortunately, by the medical profession.
Yeah, it is. We know that. And then the whole job is to put people on subscription meds for 30 years and also promise them you're not going to get better. We actually guarantee you won't get better. You probably get worse, but that's the solution. That's what we have for you.
Sorry about it.
Yeah.
Yeah, and that's not our jam. That's why we're here. So,
exactly. That's why you're here, and that's why I love interviewing people that are doing disruptive things to actually change the paradigm of what people think health is. Like, actually, let's get people better.
Right.
That's what we want.
And I want to see the public stand up for that more, and I also want to see. And it's funny, on the plane right out here, I talked to a young guy, and he was a first year med student, and we picked up a conversation, and the way he was talking, I was like, oh, I hope there's a bunch of you, like I really do, and I hope you fight hard to change your profession, because the philosophy that he had was this is vitalistic approach, like, wow, the human body can actually run by itself, like pretty much flawlessly if you let it. Just give it no interference.
Give the body the right input.
Yeah.
And guess what? The output is optimal health.
Every time. It's weird. It's like math. 2 + 2 always equals 4. It's and
unless you're Terrence Howard, 1 + 1, and I think he said is not 2. So
right.
Okay, so we have this. I see the progression. I also see on the table, though, you haven't mentioned mouthpieces. I know Dr. Downs mentioned a little bit about mouthpieces, but so we have the tone stimulator, we have the tracking devices, the tongue puller outer, the bongo for nasal respiration. Talk about, and then what's the next step? Is that the mouthpiece?
So this is like this one here, the 𝘱𝘕𝘰𝘗𝘕, and then the 𝘱𝘯𝘰𝘱𝘕 is called. They're I guess similar in the idea of we're trying to increase tone, and we're trying to change the shape of the face through muscular contraction. This is just stimulated via vibration and electricity. This is through mechanical action where the patient actually chews on it, or the child. It really helps.
Like literally put it in my mouth and bite down and start kind of chewing and working.
You can see all the little bumps in there, and you put it in your mouth like a mouthpiece, like playing football or something.
And how often a day would I do that? And
about 20 minutes a day, and then
someone screwed up like me, by the way.
You could also you can do, this can be used on adults, but it won't get the kind of changes in your facial structure that a child would get.
Yeah, we
can actually broaden the child's arches with this 𝘱𝘯𝘰𝘱𝘭𝘦. This was invented by a dentist. It is now a company from Australia that's owned by a chiropractor.
So the professions are already trying to blend. They just don't know it yet. We're trying to make that like a commonplace where chiros and dentists will cross
start talking to each
and
other,
really create a synergistic approach to change lives.
Yeah, that's so cool.
Yeah.
I think collaboration is where it all stems from anyways. That's what makes us apex predators, is collaboration. So I love that. So so the mouthpiece, so then that one is specifically for chewing, and I wasn't even aware of this. In James Nestor's book Breathe, he talks about the masseter. muscle in the jaw, and how important it is not only for the tonality, the actual structure of the jaw and widening the face like you're talking about, but also creating stem cells and bone growth. We have an epidemic of osteoporosis, and I didn't realize, I think he said in that book, correct me if I'm wrong, that that is the only way we can make, like, I guess, stem cells that create bone so that we actually have strong bone. I always thought, oh, you need to have vitamin D3 and K2. No, like you also need, apparently your masseter muscle needs to be working. Is that right?
Absolutely. We got too many people slurping their meals right now, blending them up and drinking their meals. We're not doing enough chewing. It's just absolutely disruptive to your health to not use your muscles like they were intended to do. And children who are nursing, in other words, they are, if you see what they're doing, they're not sucking, they're actually chewing on the breast. That is a very important thing. And it helps develop the child's jaws, broaden their jaws, and create space for the teeth. If there's not at least a nickel space of space between the lower baby teeth, in other words, lots of gaps between the lower front teeth, then that child doesn't have enough room for their natural teeth and their permanent teeth to come in. So you need to be looking for these things at an early age. And intervention has to take place at an early age with a mild munchie or whatever else that child may need from a dentist to compensate for what we're doing with our modern faces that are so screwed up right now. Excuse my language.
Yeah. Okay, so I've seen all the devices, and then I'm just imagining for someone like me, I already know I'm going to come see you. And I'm gonna fail your test miserably. Just so you know, like I'm already very aware. I know I'm gonna need a mouthpiece. What does the mouthpiece, I guess, look like? And I guess I'm just wondering, like, the process of the mouthpiece, like how someone like me, is that like you'd probably wear it for 3 years and that's gonna help widen out the mouth? Do I have to come once a month? Like, cause like with Dr. Dwight Jennings, I would go once a month. Like, how does that process look if someone gets a mouthpiece?
Well, let me just talk about. This is a regular mouthpiece. It's called an Avant. It has a little strap.
It's just that wire.
Yeah.
Wow.
That wire. And then you can see the lower arch is further in front of the upper arch on this. Now you can make these bands different sizes so that the jaw can either go further forward or further backwards. You can actually bring the jaw too far forward. Okay. It doesn't need to be that far. Sometimes all you need is to hold the jaw in place so that it doesn't fall back when you're sleeping.
And this would only be worn while I'm sleeping? Or
this would be
throughout
worn
the day?
while you're sleeping. Yes,
okay.
that's right. And this would not be something that you'd quit. You'd have to use this the rest of your life.
I'm fine with
Now,
that.
there are treatments, though, that dentists are doing with Invisalign and other types of clear aligners that will broaden your arches and upright your teeth that are tipped in and open up the suture in the roof of the mouth, in addition to the broadening with the Invisalign. And that can permanently create space for the tongue so that it now doesn't have to crowd its way back into your throat by creating space.
So Invisalign is not bad. I thought Invisalign was part of the Western typical dentist, that they crowd your teeth and make them narrow because they want them to look nice, which they do look nice and straight. But there are dentists that are using Invisalign for the purposes that we're talking about, widening those.
Absolutely.
Okay, cool. I didn't know that.
Yeah, so, I mean, anything can be done for good or bad that we do, okay? And Invisalign can be very good, or clear aligners, let's just say, and clear aligners can be very good for actually widening the arches permanently and creating more space for the tongue. But at the same time, many times we can actually make nasal passages larger too.
Wow.
Because that is opening up. If you open that suture up in the roof of the mouth, and sometimes we actually drive little implants into the roof of the mouth with a screw, and we actually separate that suture with a screw that we change every day, and that widens the upper arch. It's called MSE, maxillary skeletal expansion, or MARPE is another name for how you do that. And those are really important. And then there's a lot of other types of therapies like the out there that will widen the arches permanently. It's very good for your
And this is why
breathing.
when I see things like that,
grab
it's
the
so
mic.
great. Oh, it's so great to have, like Rick, essentially, by meeting him, my middle child, Ayla, she has Down syndrome. And Down syndrome people tend to have very, very narrow arches, which is why their tongues typically stick out. They have a hard time speaking. And so he clued me in on this. And so we got her a maxillary expander. In a child, since the bone's not fused, we have all the room in the world. So it's just this little device in there. And every day I just would go and turn it, and it would use the teeth and spread her maxilla apart. Wow. So now her numbers have come way down. Yeah, I don't know if this would show up on your camera, but that's the difference pre and post.
Wow, that's a
face.
big difference, man.
Yeah.
Were you able to show that on the camera?
I don't know if that would be
Adam, tell me if you
showable.
If you're able to, or maybe if you
let's see, it would just go way up here.
Wow, that's a big difference.
Yeah, I don't know if you can see that, or I mean, I can kind of see it.
Yeah.
She'll be in the book.
Wow.
Yeah, she's got about.
There's going to be a lot of before and after pictures in the book.
Very cool.
Yeah, you can see her whole face changed.
And it's so crazy because I was talking to you guys beforehand about a guy I interviewed in Laguna Beach who has done numerous, I think it's sinoplasty, where they shoot a balloon up your nose and it helps move the sutures in the brain. And he was telling me it's not just about widening the nasal passage, it actually affects the pituitary gland axis, which deals with hormones and kids' growth. And he said, Joel, this actually was invented for, I think, Down syndrome, kids with Down syndrome, and they have actually good results with doing balloon therapy. I had no idea. I just thought it was because, I have a deviated septum, I want to breathe better.
Right.
He's like, yeah, that's great, but like he's seen people remove like emotional trauma and just years of like trauma that they had and like just leave their body from doing that kind of phenomenon. And I think it all ties in also back to what we're talking about today here with the jaw, nose, the face, the brain. It all ties up. It's not just a superficial thing.
Yeah, well, I mean, we're pretty much always breathing, just like our brain's hopefully always on. And one of the coolest things is when we can help someone have the space to actually breathe, and they're breathing through the nose specifically. Multiple things happen. One, it stimulates or triggers the parasympathetic nervous system to engage. It says, okay, we're breathing through our nose. That means we're not breathing through our mouth, so we're probably not running away from a lion or a bear. There's probably less threat. It tells the brain we're safe. Let's drop into parasympathetic activity when we breathe through the nose. The other thing is the more oxygen that we can get to travel through the mucous membrane, you will actually begin to stimulate nitric oxide production. Nitric oxide, that's what they make Viagra and Cialis out of. We make it, but we tend to make it less as we age because we stop breathing through this.
Yes, we do.
And so if we can bring this back up, well, guess what? Now we've dilated the blood vessels without raising heart rate, without messing with our blood pressure. In fact, blood pressure actually tends to drop because the volume expands. So now we're seeing patients with all sorts of, maybe it's erectile dysfunction in men, or maybe it's patients with neuropathy. Like, we're starting to see a reduction in those symptoms. It's not curing them, I wouldn't say that, but we're seeing change.
Yeah.
And it's just by breathing through the nose. It's almost
wild,
too easy.
right? Yeah, it's almost too that. Okay, and it's so funny. I was talking to my brother who years ago told me, Joel, you got to read the book by Matthew Walker, Why We Sleep. And I said, I love reading about health, but I said, I know why we need to sleep. It's important. Like, I don't need to read a book about it. So he's like, you don't understand. It's really good. So really I read the book and I was blown away. I was like, oh my God. And then I'm telling him all these things. So I just finished Breathe and I said, Adam, you've got to read. I said, it's just like the book, Why We Sleep. It seems so obvious, but the way he carries the stories on, I left that book just saying to myself, when I go back home, this has got to be a priority because I haven't prioritized 100%. It. And I always say I'm too busy and I need to breathe more. No. Like, this is gonna have so much more downstream effects overall for health everywhere. I just was blown away by just people healing themselves from scoliosis to breathing correctly. Like, you just breathing, it's so basic. But as a guy who loves to go like yourself, I don't take the time to. I know I'm shortening my breath, and I'm making it worse with my sleep patterns and the way I'm sleeping right now. And I know, and I'm feeling it when I wake up in the mornings. And I've woken up out of breath, like I couldn't catch myself. So I know what's happening, and I need to nip it in the bud now.
Yeah, you bet.
I'd just like to capitalize a little bit more on what Shane said here, and that is on the nasal breathing. It's so important to actually get your people to breathe through their nose. And if you see a child eating with their mouth open, or they're actually walking through the day with their mouth open, they're in an abnormal situation. It's a serious problem. People don't know that. And they've got commercials on television showing children with open mouths nobody even has a clue that that's bad. I want to say one thing. I want to clarify something. When I say that 25% of people who are treated were cured, I'm talking about 𝘱𝘯𝘰𝘗𝘴𝘵 therapy right now. 𝘱𝘱𝘯𝘰 is a therapeutic system that broadens the upper arch, but it does other things as well on the lower arch and the muscles around the pharynx. So 𝘱𝘱𝘯𝘰 therapeutics are the people who got the statistics by the FDA and actually showed a 25% cure rate.
I was going to ask you, because by the way, the FDA and CDC doesn't allow you to say you can cure anything
That's what I'm saying.
unless it's a pharmaceutical drug, then they can say
Right.
that.
So what I would say this, rather than use the word cure, we would say that the parameters that you measure sleep apnea by were brought within normal limits. In other words, an AHI score, the RDI score, and the saturation levels of the blood, those were brought into normal range with 𝘱𝘱𝘯𝘰 therapeutics. So rather than use the word cure, I think I'd prefer to use that word, that they brought
Thanks for
those
clarifying
within
that.
the
Yeah,
normal.
Yeah, I don't want to get banned.
In my opinion, in my own practice, I would consider that a cure.
Yeah,
Yeah.
I know what you mean. I knew
Okay.
what you mean. I was going to ask
Yeah.
you to clarify. I'm glad you
Yeah.
did on your own. I wanted to ask you for that jaw, what is a typical appliance cost for people if they're looking to do
Well,
just that nighttime retainer, essentially?
I would say that the average dental practice takes the impression, makes these appliances, and helps titrate them to fit. It's around $2,500 to $3,500.
That makes sense.
Yeah.
I was thinking 3K. That
Yeah.
was what I thought.
Yeah.
So that's
Pretty
pretty normal, and I think
And
that's
what we
pretty-
do, I think Dr. Shane explained this circle ring. We use
Well,
this.
we haven't got into it actually, other than that he said he uses it for biometrics. But I would love to talk more about that, Shane, because
This is
I know
very
an Oura
important.
ring, and I think you would poo-poo
Yeah.
on an Oura ring. Say, Joel, that's cute, but
It's cute,
It's
yeah.
cute, yeah.
This takes a reading every second as opposed to what other rings will do. And it actually is an FDA high sensitivity pulse oximeter recognized by the FDA for that sort of thing. You can talk a little bit more about it, Shane.
Yeah, it's a device that we use. I'm not an owner of this company or anything. I really like working with them, and it's so sensitive. I talked to
What's
their
the brand, by the way?
it's called Circle.
Circle Plus.
Circle Plus.
And is that-
CIRCUL.
Is
Yeah.
that doctor prescribed too, or
Nope,
is that
you
is
can
that-
buy these.
You can buy it.
Buy them on Amazon.
Gotcha.
But what matters, no different than any other wearable device. I think the beauty of this is when someone has this and they're tied to a chiro dental combo, now you get doctor interpretation of what that data actually means, rather than just saying, cool, it's on my phone and I'm yellow today or I'm green today, whatever. So we're actually taking over the data and then guiding the patient, like saying, hey, this is working, or hey, this is not working. And so, but what I found out about this is Doug, he's their CTO, Chief Technical Officer. He said this is actually 100 cycles, so it's 100 hertz. There's 100 bits of data per second are being measured by this thing, and there's nothing like it even close. A friend of ours, and we're going to be expanding into a different platform to aggregate this data. But one of the number one wearable device doctors in the world, I gave him one and let him use it, and he called me up and said, Shane, this is the best data I've ever seen off of a wearable. And so it's specifically, though, for sleep. I know a lot of people like their Fitbits or their Apple Watches or whatever, and I'm not opposed to any of those. In fact, the platform we're making is agnostic. So we're going to be pulling data from any and all wearables that anybody of our patients wear. And then we're just on the back end, all the nerd stuff, doing all the data aggregation on how that we want that to present. But this little device here will give us every single night a highly accurate HRV, SpO2 levels, temperature, circadian rhythm, sleep cycles. I mean, just everything you can think of to actually have real data to make real decisions for the patient. So if we implement a strategy, let's say we do a bongo or a munchie or an INAP or whatever, we have data before and we know when they started, and now we can go for a couple weeks and be like, are we making progress or are we not?
Yeah.
And that's the most key thing is a lot of people, even if let's say they get a CPAP and they can tolerate it and they wear it, well, is it working? No one's testing. All they test for is did you wear it and did it get sealed to your face? They're not looking at physiological markers to see if it's actually helping or not.
Yeah.
So that's what this will help us do. So we can we can be proactive and preventative with the patient.
Yeah, I love that. For the data you're seeing, just curious, and I know we're in the early stages of this, but what have you seen anecdotally from like HRV numbers just in the time that you've started changing the breath?
Sure.
What are you guys seeing in jumps? Are you seeing an average of certain, like people are jumping 10 points or like, what do you typically see?
Yeah, well, we definitely see an improvement once we find the right combination of things that the individual needs. But yeah, HRV numbers are steadily increasing up to a point. You know, there's certain things in the daytime the patient might be doing that might be bringing those numbers down, lifestyle-wise. But we're seeing an increase in those numbers. We're seeing a decrease in what's called ODI, oxygen desaturation index. So the amount of times they go into like suffocation, apneic modes is decreasing. For example, five and under is where we like to see patients. I've had some, we start at around 20, so they're suffocating very often. And just by changing nasal passageways, and using some of Rick's sprays here that I'll have him talk about, we're getting those numbers down to like 7. So we're almost into normal limits just by addressing nasal cavity.
Wow.
And so some folks, we've got them down below 5, you know, then we'll work on changing diet and getting them non-inflamed with the foods that they eat to decrease the size of the lymph and all the nodes and whatnot. And that makes obviously a big difference. But it's just so cool to have something in real time every night where we can actually watch someone recover or not based on what they did that day. And it's taking a lot of the, well, I think it's working out of the equation.
Yeah.
You know, and it's really great. And I think we're at, it's 2024, man. We're going to see this explode. I think
you're right.
I think we're going to see data and metricing go through the roof over the next 5 years.
Yeah. No data, no drama. That's what I love about it. It's objective.
Numbers.
You can't lie about that. And that's the beautiful thing. And I know a lot of guys are data driven. And so there's no feelings in this. This is what it is. And are you getting better or not? We have that data. So that's really nice.
Yeah. And it takes, I don't know, maybe for the whole profession, but I mean, for me, like, I want it, like when I adjust a patient, first of all, we use thermal imaging to figure out if they need to be adjusted or if they don't. And then if we do, we measure them after to see if we did it. You know, like, cool, it made a sound, but did it accomplish the goal, right? And so we use that imagery. And I'm the first person to say, I want to know immediately if I'm wrong. Like, I mean, I'm pretty good, but I'm not perfect.
Yeah.
Like, if we're doing something that's ineffective for the patient, that's not okay. Like, and I'm totally fine with being wrong. As long as I know, then we can pivot, adapt, try again a different way, and then get it until we get it right.
Yeah.
You know, ultimately the patients, they got to get the results. I mean, that's what they're paying us for, you know, and if we get it wrong, like they're just going to keep being sick, and that's not okay.
Yeah.
So
I wanted to ask you briefly, and I know Dr. Downs just stepped out for a second, but he mentioned some appliance or system with that the FDA, that 25%, it started with a V,
Oh yeah, that's like that's something, again, that's why we partner with dentists, because they can, I can't do what they do. That's the actual widening of the arch. That's where in an adult, where the suture has fused, where the plate that creates the top of the hard palate is now locked and fused. They'll literally wiggle that sucker apart and then begin to widen it. And they use, in an adult, they can't use the teeth as anchors. That's where they put pins into the maxillary, the hard palate.
Yeah.
And then they'll put in this similar adapter in there where there's a little weird screw. It looks like an Allen wrench, and you just kind of crank on it a little bit every day, and it literally
slowly starts to spread out.
Pushes it apart. Palate. Yeah.
Wow.
It's pretty trippy. It's a little more invasive because again, the plates are sealed. Yeah. But, you know,
putting a screw in my freaking thing.
In your hard palate. It's a little gnarly, but I mean, you know, if you can not cure, if you can be within normal limits and have a 25% shot of that, it's probably worth it.
Yeah. I think and not knowing what I don't know, I think if I can sleep at night with an appliance like the one you have there, and I can do all the other lifestyle things, whether there's the bongo, whether it's the masseter strengthening and the tongue strengthening, I'm happy. Yeah. Because like that's gonna be the most bang for my buck at my age and stuff, is making sure I'm sleeping right through the night.
It's
and
critical.
then if I'm doing all the other lifestyle things to improve the breathing and the airway, I think I'd probably be good. But I don't know what I don't know, so we'll have to run some tests. I know you and I were talking about that beforehand.
We'll test.
We'll test, not guess. And we'll see what's going to be the best route for me and my family. It's exciting to to learn about. One thing I was also thinking about was when Dr. Downs was talking about that tightness. I remember my doctor in Marin was telling me that my son had a tight frenum, which is like that upper part of the gum, right? That frenum, I believe, right? Or is that the, yeah. And I guess that part, he's like, just be aware, like we'll see things typically in the profession with vitamin B12 deficiency. That's how that can get caused. And that tight frenum, though, again, creates the tightness in the jaw, and that can lead to airway problems later down the line, yada, yada. So it's just interesting what you were talking about, that opening that maxillary, I forget what the phrase you used for the name of that, but it reminded me of that.
Yeah, these are labial frenum, and then there's the lingual frenum, which is under the tongue.
Underneath the tongue.
The lingual
too,
frenum is the one that's most problematic generally, but all these frenums that are too low and too tightly attached can interfere with nursing for a baby. So they need to be relieved at some point in time. And generally you want to do that early in the baby's life so that they can latch properly and develop a good facial structure from that. So and by the way, as a child gets older and an adult has a frenum too, and they get released, generally they have to go through oral myofunctional therapy first, before the frenum release, and then also after the frenum release. So oral myofunctional therapy is a big part of what we do as dentists and chiropractors. It's very
cool. Talk to me a little bit about, I think we've covered all the tech, we've covered the process. I want to start wrapping things up, but before I do, talk to me about some of the nasal rinse and some of the things you have. I'm really fascinated to know about this because I had a guy on my podcast, we were talking about it, he goes, Joel, you don't understand the nasal cavity. It's like something ridiculous, like 4,000 square feet. I said, no, it's just like this. Maybe it's not 4,000, it's like 100, I think 100 square feet. And I'm like, that's impossible. Like, it's just like this little passageway. He goes, no, he goes, and that's why you just shoot a spray up. Like, that's like one part of it. Like, and what he did to me and what he found a lot of success was, Dr. Downs, he has a bottle like that. He had me sit back on a table and he essentially waterboarded me, and he said, I've done this to multiple people and we've seen like things that they could never come out. That was his technique, and he was explaining to me like this 100 square feet cavern in your nasal passageway that you don't think exists. So talk to me about what excites you about this nasal spray and what you're doing.
Well, we've noticed that nasal sprays, there are many different types. Some of them are steroids, some of them are anti-inflammatory, some are antihistamine. They all have their place and used appropriately, but long-term use, I made a nasal spray. By the way, we just brought this out. This is the first it's been brought out. This is the debut of this rinse.
Hyponasal.
It's named hyponasal because I make it from hypochlorous acid. Now, hypochlorous acid is what your white blood cells make. They make hypochlorous acid to kill bacteria, virus, fungi in your system. It also regulates the immune response. And so this has been made at a specific pH and a specific concentration to be able to use daily. Okay, so that's just been introduced. And then another one that I produced was this surface and hand cleaner, which is twice as strong as this, and this can be used on tabletops, kitchen counters, around food. It's completely safe for animals.
And it has the same stuff in it? It's
just
stronger?
Has same stuff, but it's actually made with this is made with an ion exchange. This is made with a different chemistry. Neither one of them have any salt in them. Most of this is made by hypochlorous, by electrolysis of salt water. We don't do that. This is a very proprietary method. And this is about 100 times more powerful than bleach for killing bacteria. You can spray this in your mouth and swallow it. It's that safe. So better than the things that we're using presently in our homes with quaternary ammonium wipes and things of this nature, which are not good for you.
Nope.
And this will actually kill spores, which those will not do.
Like mold spores.
Mold spores and C. difficile.
C. difficile?
C. difficile.
Which is a huge we see that in autism. We see a high rate of C. difficile in autism.
Yeah.
Wow.
So this is amazing product line, and it's just come on the market today. As a matter of fact, this is the introductory meeting. And this, I believe, will be a very big seller among chiropractors and dentists. And not only that, but it'll actually shrink the turbinates in the nose, so it opens up a larger airway in your mouth, in your nose, So that nitric oxide, as mentioned by Shane, will be actually able to be produced.
Very cool. I have another question on that. Can I nebulize with it? Because that's been a big thing in the
Yes, you
pandemic.
can.
We saw a lot of nebulization.
I've been nebulizing this one,
Okay.
and then you can actually use it to clean your CPAP mask.
Well, if I'm working with you, I don't need a CPAP anymore. So,
Well,
but okay, yeah.
Some people still need
Yeah,
that.
yeah.
So I have a tickle in my throat today. That's why I keep breaking out. So
Yeah, no worries.
sorry.
You need some of that in your mouth, I think. So the spray. This is amazing stuff. I want to wrap things up. Is there anything I didn't ask you guys that you wish I had?
I think you pretty well covered the whole thing. I mean, that's you bring them in, we monitor, we measure, we make decisions, we measure again to make sure the decision was good.
Yep.
And then the idea is we try to create sustainability, in the outcome.
Well, I'm excited to work with you guys and journey my own result, but then also when your book debuts in November, we'll have you back on and we'll talk some more, because I think a lot will, as you know, transpire from 6 months from now. So it's going to be really cool. Last but not least, if people are listening to this episode and they just want to reach out to you, they want to connect with you, where can they find both of you, either on, is it social media or just your websites, where they can connect with you guys and learn more about this whole process?
OnlineHomeSleepStudy.com for the general public, and for professionals, it would be Sleep Balance Academy.
Okay, awesome. Sleep Balance Academy and online.
OnlineHomeSleepStudy.com.
Online home sleep study.
OnlineHomeSleepStudy.com
Awesome.
for everybody. And then if you're a professional interested in taking these systems and protocols and putting them into your practice, if you're a chiropractor, sleepbalanceacademy.com, you can get a hold of us and we'll coach you through the process.
Awesome. And then Shane, I know you're doing stuff also with, you have a mastermind. If people want to connect with you, I know you're working in the next year or so to bring chiropractors, dentists, professionals, and entrepreneurs like me, anybody, right? High achievers that want to go to the next level, but also want that balance in their life.
Right.
If they are interested in learning more, I know we're in the early stages of launching that, but if they're interested in learning more about what you're doing on that end, where can they connect with you?
Well, thanks for bringing that up. Yeah, the website's still active. The dates are different, but it's called it's TahoeTransformationExperience.com. And they can go on there and see some of the speakers that'll be there. They can look at the house, and most importantly, give me your name and email, and I'll reach out and talk to you in person. That's going to be a life-changing experience, maybe a 4-day experience up at the lake. The whole concept there, similar to what we're trying to do here with health, is, the idea is we want interference-free living. If we remove the interference from the nervous system and from the airway, the body by default does pretty darn good. Yeah. And I feel like if we can just transcend this from just the body, and we can start doing this with our emotional state of being, our spiritual state of being, like just have an interference-free connection to this amazing world that we live in, by default, we're healthy and happy and joyful and peaceful. And that's what that experience will be about. And we will be doing on the body day, it's a body, mind, and spirit retreat. Everybody's going to get a sleep study. Everybody's going to get a ring. We're going to do a lot of neat stuff for them to make sure we get all the body stuff taken care of.
Amazing.
So
amazing stuff. Dr. Shane Smith, Dr. Richard Downs. Appreciate you guys so much. Thanks for being on the show.
Yeah, thanks for having us. Super appreciate it.